Well, good morning, Bill. You're on the air.
Good morning.
Oh, hi. How are you, Bill?
Not too bad. I got out of the hospital yesterday after getting cleaned out again, and
You have hemochromatosis, Bill.
I've got terminal liver cancer, caused directly by hemochromatosis. I'm the one you were referring to that had 6 months.
Oh dear.
Well, no, I'm not. I'm going to beat that one.
You're going to beat. I hope you do, Bill.
You bet. So, Bill, how you went through your life not knowing that you had hemochromatosis?
Oh no, I found out when I was about 38 years old. So I've been fighting it for 30 years.
So you've been treating it and fighting it for 30 years.
Yep, I've gone from twice a week phlebotomies to once every 3 months has been the main therapy, I guess, for it, so to speak. But it's been it's affected your lifestyle because you're always having to be conscious of it, and it's been maintained. And I maintained a normal life pretty well up until just recently when the liver did kind of take over.
Now, forgive me for prying, but that's what I tend to do here. Did you look after your liver in other ways, knowing you had this? Did you try to avoid overconsumption of alcohol and avoid exposure to chemicals and that sort of thing?
Not any more than normal.
Yeah. Dr. Adams, here we have a man who's known for many years that he has this. He went through and had the treatment, had blood withdrawn on a regular basis, and now he's fighting cancer of the liver. Is that, to you, is that at all discouraging? Or how do you view it?
That occurs in people that have cirrhosis of the liver mostly, and the way that one is diagnosed with cirrhosis is usually a liver biopsy. Not everyone's had that done. Even after removing the excess iron, there is still a risk in a patient with cirrhosis. This has led some people to recommend regular ultrasound examinations of the liver to look to see if they could pick this up early. There have been some newer treatments in the treatment of liver cancer, chemotherapy-type treatments, and I would encourage the caller to make sure to see if he could get into one of those kind of treatments.
Well, I've been through the BC Cancer Clinic, and they've had written off the chemo and radiation and everything. They just said, go enjoy the rest of your life.
Okay.
And a transplant isn't in order, I take it? Or
not at my age.
Right, okay.
No.
Bill's story is actually going. Bill has consented and written his story, and it's going to be in our next newsletter that comes out in the fall. And thank you, Bill, for doing that, because I think your message will help a lot of people do something early about this rather than going through the pain and suffering you've gone through.
It's been quite interesting in that over the years I've trained a lot of people looking for hemochromatosis. Or not trained them, but made them familiar with it. And it's nice to know now when you go into a hospital, they know what you're talking about. A lot of times before you go in, and I've been asked everything as to, do you eat out of a lot of iron pots and all kinds of questions off the wall that they just didn't understand it.
Yeah, it's sad, but it was this in some ways. Was this kind of treated as a joke, Bob? At one time, hemochromatosis, oh, come on.
No, I don't think so, Brian. I think it's just not the first thing that comes to mind when someone presents to a GP and says, I have diabetes, or that's the diagnosis. You treat the disease, diabetes, and with so many people without doctors, regular GPs, so many orphans in the medical system, a doctor's got so many patients to see, 7, 10 minutes. It's really hard to get a long medical history and to find this genetic genotype that could cause this. So I think it's just missed. But by doing the kinds of things we're doing here today and getting the awareness out and getting more people on board who can be more of a broader membership across the country, and we raise more awareness about this, the more work that Dr. Adams does and others do to build this, I think is perfect. And one of the things we have in BC and Alberta Alberta is a protocol. It's a best practices for general practitioners to follow when they see something come up. We don't have one in Ontario, and when I was meeting with Dr. Adams, I was giving him an encouraging word that I've got a few doctors here in Ontario that want to put together a protocol, a medical protocol, that would help general practitioners diagnose this earlier.
Are we making any inroads in that, Dr. Adams? Do you
Well,
see
I mean, there's lots of printed information out there already about this. Really, the big advance in this area has been the genetic blood test, which is now the most common genetic test done in Ontario. The test is available to any patient in Ontario, no matter how rural. The blood is sent to the Kingston DNA Diagnostic Laboratory. The test is also done in various cities in Ontario as well. But the point is, you could have this test done in Wingham and sent to Kingston. So that's widely available. Now, some doctors aren't familiar with the interpretation of the genetic test result, and that takes a little practice.
But we need to encourage them, Paul, don't we, to have the GPs do the test in the first place, and that's what that protocol, Brian, would be.
Now, the other point is that there are many people who have elevations in their iron test, like ferritin, who don't have hemochromatosis. That is, there are false positives on that test. And the other things that elevate that are things like obesity and daily alcohol consumption. Both of those are very common in our communities. Any type of inflammation in the body, arthritis or any chronic inflammation, can elevate ferritin. So this has led to a misdiagnosis, an overdiagnosis of hemochromatosis in a lot of people that don't have it, and yet there are other people around that do have it that never seem to come to medical attention.
Sure. So the protocol in BC says that we also have to do a transferrin saturation percentage along with the ferritin test, and when these two come together, we get something that's called a total iron binding capacity, and then we can diagnose it more clearly.
You have a confluence of data there.
That's
Let's take a quick break. Bill, many thanks for your call. Thank you so much for sharing with us.
Yeah, just make one last comment. I mean, the whole thing is it's very treatable if you get the phlebotomies. I mean, I led a normal lifestyle mainly because I was forever getting the phlebotomy. Once my iron levels get up, I went in. So you can still have a good life, even though you got hemochromatosis.
All the best, Bill. Thanks so much for sharing.
Thanks, Bill.